We are always happy to welcome back one of our resident guests. We're going to call him Dr. Edward Mackay, where we are once again going to talk about vein circulation. Good morning, Doc. How have you been?
I've been great. Thanks for having me back.
Well, we always appreciate when you were here, and I'm really excited about today's topic because it is in the headlines everywhere. We're talking about insurance. I am assuming you get this question all the time in your office. Is it covered? Is it not?
Well, it's varicose veins, venous insufficiency is generally covered by insurance if you're having symptoms that aren't responsive to conservative measures, and that's usually meaning compression stockings, but we try other things such as walking, exercise. So the insurance companies all want us to show that you've made an effort in other areas to treat this. So we have to walk that line with the insurance companies. So it's for symptomatic problems. If you have something that you just don't like the look of, now the insurance companies won't like to hear that. But we have, cosmetic treatments as well, so we can treat those things. But to get insurance covered, you have to do it for the problems you're having with your veins.
And I'm just curious, and working with doctors' offices in the past, if there is a patient that does have this need because of their health reasons, and it has been documented, is it still a fight, or is that something that your office can help the patients with?
Oh, it's still a fight?
To get covered, to make sure that you're getting
It's
the
always
coverage.
a little bit of a fight by us. So we have to, some insurances require both the primary care referral and the insurance has to approve it. So you have two different people you're dealing with to try and get it covered. Usually it's not a big problem, but it's sometimes hard to get into those offices and get them to respond. But so there is a little fight, and we have to document the conservative therapy that I mentioned, and then you have to really document the symptoms. And they really sometimes want to know specifically what is this causing them, preventing them from doing that they wouldn't otherwise do, and that's kind of hard. Because most people still go about their lives even though their legs are hurting. So you have to be able to tell them how this is really stopping them from getting their job done. So it is a little bit of a fight.
And the reason I ask that is because I always want a doctor to work with me and make sure he's on my team. And it sounds like you're on the team of your patient. And I guess that's what I wanted to point out.
Yeah, well, we work hard to try and get them covered for their problems.
But of course there are those cosmetic ones that you touched on as well. And so as far as the services that you do provide, let's kind of do an overview just so people know that what they can get, whether they need it or it's just for cosmetic reasons.
Well, we run the gamut from little spider veins to deep venous reconstruction using stenting and balloon angioplasty and things like that. So it's everything in between. The most common is the varicose vein, so that's what most people see us for. But we do see a lot for the little spider veins on the legs, and we do a lot of cosmetic treatments for that as well. So that is very common.
And I'll say, Dr. Mackay, one of the things that I always enjoy talking with doctors about is that feedback you get after the procedures, after people get their lives back, after they're not in pain anymore. Talk about what you do hear from your patients post-treatment.
Well, they have to be followed very carefully and make sure that they get the results that we're expecting. And so that means we usually follow them up several times the first year with ultrasounds just to make sure that everything's healing the way it should and that they're experiencing the progress that we expected to see. But they generally come back with a real dramatic, better feeling leg, that they're able to be on their feet more without just fatigue and discomfort. And if they've had the ulcers on their legs, they usually heal up very rapidly after you fix their venous insufficiency. So. And
I gotta say, it never gets old though to get that "good job, doc, you fixed it," right? That never gets old.
I really appreciate that, yes.
Well, one of the things too that we do want to end on, free consultations right now for our Morning Blend viewers. You're helping them out to see if you can help them out.
Yeah, we bring them in, let them see one of our techs, ultrasound techs or nurse or PA, and they can kind of examine them and go over their symptoms and see if it is something that really will help them.
Sounds good. Dr. Mackay, we always appreciate when you are here. There's his information on your screen.
All right, thank you.